pharmacogenomic testing can play a valuable role in the treatment of hypertension and heart failure by providing insights into a patient's genetic makeup and how it may influence their response to certain medications. Here are some key considerations for pharmacogenomic testing in the context of these conditions. 1. Drug selection. Pharmacogenomic testing can help identify genetic variations that may affect an individual's response to specific antihypertensive and heart failure medications. By analyzing a patient's genetic profile, clinicians can better predict their likelihood of benefiting from certain drugs or experiencing adverse effects. This information can guide drug selection and dosage adjustments to optimize treatment outcomes. 2. Individualized dosing. Genetic variations can impact drug metabolism, efficacy, and toxicity. Pharmacogenomic testing can identify specific genetic markers associated with altered drug metabolism enzymes, such as cytochrome P450 enzymes, which play a crucial role in metabolizing many medications. This information can guide individualized dosing strategies to achieve optimal therapeutic levels while minimizing the risk of side effects. 3. Adverse drug reactions. Certain antihypertensive and heart failure medications may have a higher risk of adverse drug reactions in patients with specific genetic variants. Pharmacogenomic testing can identify these variants and help clinicians avoid prescribing medications that may pose a higher risk of adverse events, such as severe hypotension or drug-induced cardiotoxicity. For treatment response prediction, genetic variations can influence an individual's response to medications. Pharmacogenomic testing can provide insights into the likelihood of treatment response and guide clinicians in selecting the most appropriate medication or combination therapy. For example, in hypertension, some genetic markers may suggest a better response to diuretics, ACE inhibitors, or calcium channel blockers, while others may indicate a preference for beta blockers or angiotensin receptor blockers. 5. Treatment cost effectiveness. Pharmacogenomic testing can potentially contribute to cost-effective treatment strategies. By identifying genetic markers associated with treatment response or adverse events, clinicians can avoid prescribing medications that are less likely to be effective or more likely to cause harm. This approach may help optimize medication choices, minimize trial and error prescribing, and reduce unnecessary healthcare costs. 6. Patient counseling and adherence. Pharmacogenomic testing can enhance patient education and counseling. By explaining how genetic factors influence medication response, clinicians can empower patients to make informed decisions about their treatment. Understanding their genetic profile may also motivate patients to adhere to prescribed medications, knowing that the chosen drugs are more likely to be effective and well tolerated based on their genetic information. It's important to note that while pharmacogenomic testing has the potential to enhance treatment outcomes, it should be used as a complementary tool alongside clinical judgment and standard diagnostic practices. The interpretation of genetic results requires expertise, and the field of pharmacogenomics is continuously evolving. Therefore, collaboration between clinicians and genetic specialists is crucial to ensure appropriate utilization and interpretation of pharmacogenomic testing in the context of hypertension and heart failure treatment.